Hello, my name is Dr. Grant Cooper. I am the co-founder and co-director of Princeton Spine and Joint Center. In this video, we're going to be discussing foot and ankle pain. Feet are undeniably amazing. 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments. It's basically a small engineering marvel that most of us then shove into shoes that were designed by fashion designers who clearly hate feet. So it's no wonder that feet sometimes hurt. There are some common culprits of foot and ankle pain, and we're going to get into those now. So the number one, ankle sprains. Twisted your ankle on the curb, etc. Welcome to the club. Ankle sprains are the most common cause of ankle pain, period. Usually an ankle sprain is going to involve the ligaments on the outside of the ankle. Now the number two is going to be plantar fasciitis. This problem typically presents as pain in the heel, especially when you first get out of bed in the morning. It's like your foot saying in the morning, "Good morning, I hate you." What happens is that at night, your foot is generally relaxed, right? And it's flexed. And the fascia on the bottom of your foot, which attaches to your heel, relaxes. Then when you take your first step in the morning, it stretches that fascia, and that can be very painful. And this is why stretching your foot before getting out of the bed can be so effective. One way to do this, by the way, is to just take a belt and put it around your foot while you're still in bed and gently stretch your foot and calf. All right, next up, Achilles tendonitis, which is pain in the back of your heel. It's named after the Greek hero Achilles because this is obviously the strong tendon, but of course, if it ruptures, you're in big, big trouble. Rupture requires surgery, but luckily tendonitis or inflammation of the tendon is almost always successfully treated non-surgically. Okay, next up is stress fractures, tiny cracks in the bone from overuse. You could think of it as your foot saying, hey, maybe don't run a marathon without training for it first. And there's also arthritis. Arthritis is wear and tear in the joints, and this is particularly common in the big toe, aka hallux rigidus, and also common in the ankle. And this leads the joint to feeling stiff and cranky. Flat feet or high arches can also lead to foot and ankle pain sometimes as well. Either too much flattening or too much arching messes with the alignment, and it's sort of like a bad suspension in a car. Every bump, every step then feels worse. Of course, many people have flat feet or high arches and have no pain, but it's still a risk factor for the pain all the same. All right, how do doctors go about diagnosing different ankle and foot problems? Well, doctors are like mechanics for your feet. So they start by asking questions like, where does it hurt? When did the pain start? What makes it better or worse? Then the doctor will move on to a physical exam, pressing different spots on your foot or ankle. Does it hurt here? How about there? They'll check your flexibility, your strength, the alignment of your foot. Ideally, the doctor will watch you walk. Sometimes they'll order some imaging, x-rays to evaluate the bones, especially if they're worried about a stress fracture, and MRI or ultrasound if the doctor suspects a soft tissue injury or maybe also a stress fracture. Sometimes the doctor doesn't need picture because the foot or ankle tells the story itself. Okay, let's talk about treatment options. Of course, this is going to depend on the problem, but in broad strokes, there's rest, ice, compression, elevation. Shoes that don't hate you, supportive, well-fitted cushioned shoes, goodbye stilettos for a while. Physical therapy, which involves strengthening, stretching, gait retraining. Orthotics sometimes, and these are inserts that will give your foot a little architectural support. These can be over-the-counter orthotics, or you can have custom orthotics made where a mold is first taken of your feet. Medications like anti-inflammatories for pain relief. Now, I particularly like topical anti-inflammatories for ankle and foot pain because the active ingredient in a topical has a chance to actually diffuse through your skin to the underlying problem because there's not so much soft tissue in the ankle and foot. Injections such as steroids, Toradol, or regenerative therapies can be used for stubborn inflammation. Surgery is really reserved for very severe cases like tendon ruptures, advanced arthritis, or bones that just won't heal. A take-home message here, ankle sprains, plantar fasciitis, Achilles issues, arthritis, stress fractures, these are really the big players when it comes to ankle and foot pain. Diagnosis is going to be found with a combination of history and physical examination and sometimes imaging. Most cases of foot or ankle pain don't need surgery. Conservative treatments will treat most of these things. The earlier you deal with it, though, the better your ankle and foot will treat you. In the end, your feet are your foundation, right? You only get two of them, so we want to take good care of them. Wear good shoes, stretch and strengthen the surrounding muscles, and listen to your feet when they complain. Because remember, if your feet aren't happy, right, nobody's happy. All right, thank you so much for watching. If you found some value from this video, please hit the like button on the video and subscribe to the channel. If you have questions or comments, or if you'd like to share your own experiences with foot or ankle pain, then please leave a comment in the comments section. As always, I wish you the very best of health. Thank you.